Hello, future doctors. Today I'm going to help you understand and revise some of the important topics and discussions around endocrine system. Just to inform you, this is the part 1 of the endocrine series. Stay tuned to our channel for more discussions. So now let's jump into today's topic. Today we will discuss synthesis of protein hormones and difference between protein hormones and steroid hormones. First, let's discuss the synthesis of protein hormones. Protein hormones are synthesized and stored in precursor form. This precursor is called as pre-pro form. For example, at beta-Langerhans cell pre-proinsulin is cleaved to proinsulin, which further cleaved to form insulin and C-peptide. There is also a precursor known as pro-opiomelanocortin, which produces multiple hormones. Pro-opiomelanocortin undergoes first proteolytic cleavage, forming corticotropins, otherwise known as ACTH and beta-LPH. ACTH further cleave down to form MSH and CLIP or corticotropins like intermediate love peptide. Meanwhile, beta-LPH cleave down to form endorphins. Pay attention here. There is a clinical catch here. It is better to understand that ACTH has MSH-like activity. To prove this, we have to take a clinical case of Addison's disease. During Addison's disease, patients' ACTH levels are elevated. Meanwhile, there is also pigmentation seen in the patient. This is due to the fact that MSH and ACTH has a common precursor form known as POMC or pro-opiomelanocortin. Now let's discuss the major differences between protein hormones and steroid hormones. The first major difference is seen as the factor of peripheral conversion factor of both hormones. Protein hormones, once attaining its final form, will directly act on the targeted site, whereas steroid hormones needs to have some modifications before acting. For example, testosterone needs to reduce 5 alpha units here to form 5-DHT. Protein hormones are not lipid soluble, so they cannot enter into the cell easily. Meanwhile, they act via cell membrane. Whereas steroids are lipid soluble and thus can enter the cell easily. They act via intracellular receptors such as cytoplasmic receptors or nuclear receptors such as estrogen. Steroid hormones witnesses the formation of hormone receptor complex, after which the action of hormone is elicited. That's all for this part. Stay tuned for more parts and enjoy learning.